Okay, well, welcome everybody, and it's my name is James White, and I'm the CEO and owner of KBMO Diagnostics. It's my great pleasure to introduce you to Christy Hughes. Christy and I first met in Beijing, China, which is kind of a not an obvious place for functional medicine kind of people to hang out, but that was a long time ago. But we've kept in contact, as you try and do with good people, and so. Christy has also been running the test for a number of years as well. So as I say, what we really like to do is have real thought leaders and leaders in the field talk about the test who are actually running it, because obviously it means so much more that way versus people who are just lecturing. So that's one of the key things that we like to do here at KBMO, is have practitioners who are, as a concept, practicing, kind of coming on and talking. So this is a 4-part series. So Christy, if you can just flip on to the next slide.
You bet. There we go.
Perfect. The first one, which is the intro, which Christy's doing today, and then we'll be going on to talk about some cases around gut barrier panel and kind of gut health generally, and then we'll do a few more cases again in June. And the whole concept of this is to try and make this as interactive as possible, because again, we're fortunate we've got Christy here, so we want you guys to be able to interact with her as well, as rather than you guys just being talked at. That's a bit old school and not very interesting for any of us. So again, we want to try and kind of take advantage of the time we've got with Christy. And then lastly, we're going to have Ask Dr. Christy. So again, the whole idea is to make this interactive, and I know she's very good at doing that anyway, but we're going to do that. And without further ado, we're just going to give you one quick slide, which is an offer slide. So again, if you go to the kind of KBMO website and quote Christy, and then we'll offer you a discounted kit from the normal $385 down to $200 for a Fit 176, and then we'll look forward to kind of getting you up and running. If you're already a client, then that's fantastic news. We'll happily offer that as well. So without further ado, I'm going to hand you over to Christy, and we'll let her go through the stuff, and I'll keep admitting people in the waiting room.
Great. Well, thank you for having me here. I was trying to think how many years ago. So it's going to have to be somewhere in the 5 to 6 year window ago, I'm thinking, definitely pre-pandemic. And so we were teaching, the Institute for Functional Medicine was teaching and training, applying functional medicine and clinical practice and some advanced modules in China. And James and I had a remarkable dinner together, phenomenal Peking duck dinner. And it was kind of my opening and introduction to getting to hear, from our other faculty and those who were actively practicing in China using these tools and resources, some of the wonderful attributes of bringing some of these advanced inflammatory components, literally components and complements on into clinical practice. So I have to say, I came back from that trip to China, started to use KBMO myself in my functional medicine root cause-based practice. And I have to say, the clinical results were profound for me. I have always used some level of food trigger, food insight tools and resources, from food sensitivities on through, for all the years of my practice, since I was very first exposed. But I have to say, it was a game changer for me when I started seeing the clinical correlations that I was getting from my KBMO test. So I'm excited to share with you a bit of my own journey. And I want to start that by really anchoring all of us into root cause care. Right? Because what we're doing in functional medicine and why we look for food triggers and food inflammatory provoking agents is because when we are digging deep into the functional medicine model, we're recognizing that these roots that we have deep down in the soil, the roots are stabilizing lifestyle factors. This is where nourishment, nutrition, hydration reside. Right? What stabilizes us in our healthcare into the ground, into our lives today, is how we move, how we rest, how resilient we are, what kind of boundaries we set, our ability to hydrate, and our ability to stay nourished. And so making the right choices in diet and lifestyle is imperative in someone who is on a health and a wellness program. Now, the doctor, the practitioner, they are a part of the clinical team that can really tend to the tree. Right? When you are a practitioner in root cause care, if you're using nutrition-based medicine, if you are into integrative approaches in functional medicine philosophy, well, then you're not only tending the branches, you're also taking this opportunity to dig deep down into the story of the patient's life and to understand their roots and their lifestyle. You're not just treating symptoms. You're taking the opportunity to go deeper, help inform and educate the patient so the patient knows how to eat right going forward. And I have to say, if there was one tool out of all the tools in my toolbox that I literally could say the majority of my new patients and my repeat recurring patients test with, I confidently can tell you it is KBMO. This has become the absolute anchor test in my practice because I absolutely practice food first. You know, for me in my practice, food is medicine. I've got a very deep rooted practice surrounding nutrition, lifestyle medicine, and coaching. And so for me in my practice, I find that I always want to get down into the roots. I want to get down into that taproot with that patient and client. I want them to understand how important their physical, mental, emotional, and their soulful connections come back to their lifestyle choices. Like, it is so imperative that our patients have guidance, that they have knowledge, and that they know what to eat, how to eat, and how to integrate that in a balanced way, right? Because so many of us have met patients, those who have walked in the door, who come in overly obsessed with food or meticulously hanging on to potentially sometimes some of the wrong aspects of diet and lifestyle. I have patients coming in my door who are eating like 10 foods sometimes, right? And you can't live that way. Long-term, that is not sustainable. So for my patients on a full range of relationships with food, from healthy relationships to food to questionable relationships with food, this tool, KBMO, this food plan for me has been an anchor, guide, and coaching tool so that I can set the stage and move into the whole story around lifestyle factors, but begin first with food. So I position the KBMO test in my practice as one of our nourishing tools. In my entire practice, we really focus on these 5 big areas. And I can tell you there is a relationship that the data on my KBMO test has to all of them. And so in this section, we're kind of opening up the conversation. I'm going to tell you about how I choose to use a KBMO test, which one and why. And I'm going to share with you the types of cases, knowing that primarily a lot of my focus is on this concept of defense, which translates very simply to inflammation and looking at the leaky gut and intestinal permeability. So in my practice, my whole practice mindset is based around helping patients with their performance, helping my patients work through processes of restoration, to focus on invoking healthy quality nourishment, to stabilizing the body's ability to defend itself from that immune, inflammatory, and allergenicity perspective, and then at times helping my patient shed the weight, shed the body fat, or improve some of that congestion that might be present in that lymphatic congestion that is present for some of my patients. So my mindset is when I teach and I mentor practitioners, I've got a practitioner mentorship group, and I get the opportunity to run the functional medicine student group that is hosted downtown here in Minneapolis, Bloomington at the Northwestern Health Sciences University. When I'm teaching practitioners, when I'm teaching for different nutrition companies, and when I'm teaching my own mentorship group, I'm always breaking down our strategies and the approach that we're taking into these 4 areas, because these are some of our foundational root causes. So I see a lot of athletes. I do KBMO testing on a huge array of different ages and different athletic performance. My husband has owned a gym. He's been a personal trainer and a retired MMA Muay Thai kickboxing pro. And we have a lot of athletes that come into our practice or work with us through telemedicine. And so I love KBMO for my fighters, for my athletes, and for those that we work with who are looking for peak performance. What do they tell me? They can tell the difference in reducing inflammation. They are seeing the transformative diet showing up in their performance, their strength, their stamina. And interestingly to me, I find how many of them note the improvements in their recovery, right? Which is a really important piece of being an athlete out there in the world today. Okay. My goal is to help my patients deal with whatever's broken and tired and not working optimally, to restore inflammation and immune and inflammatory regulation, and to support the detox systems, where ultimately My goal is that we've worked our way through those different layers and levels with the patient, and my maintenance plan for them is focused on strength, stamina, performance, and optimal wellness. So I just kind of want to set the stage so that you can sort of see the types of patients that I am seeing and that I am bringing my KBMO testing forward with. So this category, I would say, is the most prevalent in my practice. I see patients who come with all types of challenges to optimal function, right? So my patients commonly come in with bone patterns, osteopenia, osteoporosis. Absolutely, I want a KBMO, right? Because what we know about osteoporotic change and bone loss comes back to inflammation, right? I want to make sure that my patients are on a personalized, reduced inflammatory type diet. My gut work, it is imperative that I have these tools in my toolbox, that I can look at a gut panel with my patients, that I can get a sense of leaky gut, intestinal permeability, infections, candida, SIBO, and which foods that we may need to correct. But in dealing with issues of hormones, various different energy production cycles, the musculoskeletal system, I spend a lot of time working with patients who are coming in with pain, fatigue, and they feel brain drain, right? They feel drained. They physically feel drained. They mentally feel drained, and they're exhausted and they hurt. Those patients, KBMO is at the top of my list. One that many of us would naturally connect the dots with is this opportunity to look at inflammatory related disorders. You know, I tend to be one of those practices here in the Midwest. I'm practicing the west side of Minneapolis. I see a lot of people's really challenging cases. I am rarely the first practitioner. You know, I'm usually the 10th, the 12th, the 15th practitioner, or the patients I'm working with are coming from a referred practitioner. Right. So I'm not usually getting simple cases. I love it what I do. But I have to say that, you know, in the more complicated cases, especially those with long haul COVID, mycotoxin exposures, Epstein-Barr history, CMV, infectious disease, long haul COVID, you know, kind of looking Lyme, tick-borne disease, right? As I am seeing patients who come in with either an immune and inflammatory history, or I'm seeing them coming in with a metabolic challenge, connecting us back to insulin, glucose regulation, and inflammaging. This is absolutely one of the first things that I do once I understand KBMO testing. It's one of the first things I do when I understand that I'm dealing with an immune compromised or an infectious disease related case, right? And especially the patients who are dealing with stealth infections, right? Where they have those low grade stealth infections kind of simmering and brewing that they might not even realize are either activated or compounding in regards to other lifestyle choices. And then the last category, we call it SHED in our practice. It's really to deal with toxic fluid, bifunctional modulation support, getting all those detox elements working well so that the elimination system can properly metabolize, conjugate, process, and excrete. You know, and obviously, those of you who know the MMA world or the boxing world or the fight world, we do a lot of weight cuts in our practice, right? Which is being very mindful and very clear about how our patients drop water weight, hit their fight weights, and then get healthy electrolytes and fluid back on board again so they're ready to perform 24 hours later, right? And so I can tell you, this is one of our tools in our toolbox. So if our athletes have an idea of which foods provoke inflammation and can lead to water retention, that's going to be part of our program, is we're going to be really strict and using the guidance that we get from our FIT 176 test. So we use our KBMO in so many of our patients. I think, James, in the last 5 years, I can probably say 70% of my new patients that walk through the door end up with this kit. And I think you've seen or you've been exposed to, you know, the teaching and training I do with students, and I work with mentors. Like, these are the types of conditions, the symptoms, you know, that are emerging, where my whole team of educators and my students, these are the types of patients that we draw in and we go looking at food triggers. Right? Food triggers are profound. So, you know, James, I could talk for like 4 months on this topic. So I'm going to pause a minute and let you interject.
Yeah, I mean, it's really interesting. We've got just over 10,000 providers running the test now, and we're all often asking them exactly that question. What's the right type of patient to run this test on? And it's fascinating to me to see that the list that you've come up with is very similar to what we hear. But the key to all of them is what's underlying them. It's inflammation, and I think that's the great thing about this list. It's different forms of inflammation that are brought on from the diet. And I think that's the great thing with this test, because you're looking at a multiple pathway approach. You're looking at which foods are really truly driving inflammation versus looking at just exposure, which is can be the knock on just some of the other testing out there.
Yeah. No, I think it's wonderful to have clinical conversations too, because in our roundtables and our case presentations and our discussions, we really do hone in on and focus on the differentiations with looking at classic food allergies, what data we can gather from a food sensitivity profile, which many of us have been using as an indirect assessment of permeability for years, right? I mean, it has been a wonderful component of looking at those IgG4 mediated test results, helping give us a good clinical understanding if a patient has a permeability challenge, and that might be underlying autoimmunity or detox challenges or biotoxins or endotoxins, right? So I love that with this test, we're going beyond food sensitivity testing. We're getting really clear-cut distinctions of leaky gut or not, intestinal permeability or not. And, it is helpful because in the world of managing mold and tick-borne disease and COVID long haul syndromes, we're just seeing that there's absolutely other reactions that people may have to food, which are not necessarily those showing up on our test results. And we need to honor them all, look at them through that diagnostic lens and say, okay, so what is that telling us about that food? Right? Because sometimes people have a reaction to a food, but it doesn't show up on their test. And they say, how come I don't have blah, blah, blah on my test, right? And we kind of explore and look at those various different foods. And so, for example, someone could definitely know they have a peanut response. It's not anaphylactic. It is not typed out or tested out to be an IgE-mediated type 1 allergy reaction. It may not even ping that high on a food sensitivity test. But interestingly, they may know that they react to it, and it might come back to mold and mycotoxins. Right? Or it might come back to something that was sprayed on that food in a part of its harvest and its manufacturing, right? So food intolerances can happen when it's a non-allergenic, non-sensitivity, or non-inflammatory related direct response to that food. There are other things that we do to contaminate our food, quite bluntly, and there can be challenges that emerge from these different types of food triggers. So I would say most functional providers, those who have a nutrition-based practice and integrative healthcare providers, they're going to look at this whole story from a broad perspective and recognize that the gut microbiota and the gut barrier, the GI tract, small intestine barrier, they're important components of managing allergy reactions, looking at detoxification and nutrition levels, understanding the impact with infectious disease, and this gut-brain connection and the important dance going on between the GI tract and our neuroendocrine signaling and the brain. Every month, we're learning incredibly new, insightful perspectives that really bring us back to this understanding of inflammation and all the systemic levels that can come back to the gut. So I just want to remind all of us again that, when we're dealing with intestinal permeability, this is something that functional medicine type, naturopathic type root cause doctors have honestly been talking about this and have been treating this for about 30 years. And the wonderful thing is, not only is the literature catching up with this topic, so are the labs, right? And how wonderful to be able to know that when doing a detailed medical history that will help us reveal common causes of intestinal dysregulation, we have better tools in our toolbox today to be able to pinpoint at least what food triggers might be at play as we uncover other causes and contributing factors that may be coming from our lifestyle. So I think it's wonderful. I have to say, in 25 years of practice, which this is my 25th year of practice, which is kind of strange to say, it is interesting to me if I kind of look at the serial progressions of conversations around food triggers and leaky gut, almost as a historical perspective. Patients are walking in the door today, asking for a food test, telling me that they have intestinal permeability when 10, 15, 20 years ago, And we were trying to teach and explain to patients, right, what that meant. So something I'm really excited about is this conversation is becoming more mainstream. Patients are walking in talking about their microbiome. Patients are walking in the door using the terminology that's accurate around food triggers and food sensitivities. And it's exciting to see the recognition that food, nourishment, resilience, stress modulation, self-care, restoration, and movement are truly getting in healthcare and medicine today. So why don't we transition, James, over, and I would talk a little bit, if we could, about why KBMO.
Okay, perfect. So again, we talk about this multiple pathway approach, but what I thought I'd do, if we go on to the next slide, I'll just talk a little bit about some of the key kind of history and background and how we got to where we are. So the keys we were set up by a gentleman called Dr. Brent Dorval, who's been very influential in everything we've done as a company. His not insignificant claim to fame was he invented the first rapid HIV diagnostic. And so that infectious disease background really is a lens that we do everything through today. So a good example of that, for example, is that we do 15 standards of controls per patient to make sure the testing is highly accurate and highly reproducible. Because again, if you're going to take a patient off a food, you want to make sure it's in a highly accurate test that's done that. And so having that infectious disease background has made sure that the testing that we do is very accurate and approached in that way. So we're based just outside Boston, and we've got a number of facilities here. So we have 2 clear high complexity labs where all your samples come into. And the beautiful thing is it's either a blood draw or a finger stick. So that finger stick has enabled us. That's probably why we were hanging out in Beijing, on the basis that, again, the testing is so robust that we can have samples coming from all around the world. The other nice thing is it's an FDA registered facility that we have there as well, and ISO 13485. So again, quality is key to everything we do. And again, the other thing we have is it is the only patented food sensitivity test on the market. So again, it gives us a unique position over some of the other companies out there. And that pattern is really important to us in terms of looking at that multiple pathway approach. Or as one provider once told me, what we love about KBMO is they look at the whole immune system, just not part of it. In terms of, if you just look at the IgG, you're missing the whole innate immune system, which we cover with complement activation. Again, we own the C3D cell line, and again, have developed everything around it. So we're very deep on this particular area. So again, we've developed specific ways of lyophilizing the foods onto the plates. All the foods are organic. They're all traceable, so I can even tell you who caught the mackerel that's on the FIT 176, which again is a great indicator of, is that patient sensitive to something like omega-3. So again, we talk about inflammation and how these patients are inflamed. We want to make sure we're testing them for those elements as well. And as we said earlier, this test is available all around the world. We have now labs in Mexico, Brazil, Shanghai, and maybe not a huge surprise for everyone, London as well. So the idea is, it's evolved over the last 20 years to be from, just available in Hopedale, Massachusetts, to now all around the world. And again, we've grown to just over 10,000 providers. And I think the key is, rather than just looking at what food you're exposed to, that additional of inflammation, and now with the gut barrier, we're really giving you a nice root cause tool here to say, is the patient inflamed via their diet? Then we can cope with that. Or if there's another issue going on in terms around the gut, we've got a really good way of finding out what's going on from a leaky gut perspective. And again, given that's a continuum, that's why we've got a number of markers on there. And again, some of them we've developed ourselves from scratch, like our zonulin, and then things like the LPS that we're going to add as well to kind of round out that kind of continuum approach. So we're really excited to have that. And so that's really, in our minds, a quick why. And again, another why is because, again, we believe it's a good test, but it turns into a great test when you start working with providers like Christy and others on this call. The idea is, how do we make sure that we give a tool like this in the hands of a provider? And as I say, it goes from good to great pretty quickly, because they can see the patient in the round. And so that's why, as a company, we've chosen to work directly with providers versus giving this to a consumer. Our view is, again, it's a good tool, but it's a great one when we work with the very talented group of providers we have. And obviously, Christy's a great example of that. And we're thrilled she's here today talking to you about her approaches and her use of the FIT test.
Well, one of the things I like about the application of it is I love education. I mean, it's about 50% of my time is I'm either mentoring healthcare providers in functional medicine, I'm mentoring, supporting coaches, I'm working with patient groups, or I'm teaching formal medical education, sessions. And honestly, what I love in patient care is I can use this kit in my practice. I see patients 3 days a week, right? So just one-on-one, I can order the kit. I can have it come out of the local warehouse. I can have it come straight from KBMO. I can have it in my office. I have options, right? I can do it right there on the spot, or I can send it to a patient's house if I'm working with a patient on telemedicine and Zoom, opportunities. But I also like its use as I think an adjunct tooling group. So one of the things I do in my practice is I run a closed private nutrition group, and your members of my group and those who went into the program, every one of them got a KBMO kit. And so it's been wonderful. We come back every week. We talk every Tuesday night. Everybody's pulling out their kits. They're pulling out their nutrigenomic tests. Some people might have microbiome or stool sample tests. Some people have mycotoxin tests. And, it's just great. It's an amazingly easy tool to bring into a group education experience, because what I like is when patients cross-educate each other. I like patients experiencing I like them sharing their experience and their real life story with other patients and other members who are a part of my education groups, because I think there's nothing more powerful than hearing somebody else's story. I want them to know that I'm obviously going to be choosing high discernment, high discretion, and authentic choices in the labs I'm choosing. But there is something amazing that happens when they join a group of 20 other people who can share their stories about getting off of their food triggers, right? The support, that comes in those kind of environments is phenomenal. So in my mentorship groups and in other physician related groups and practitioners, who are the types of patients that we tend to lean into KBMO testing for, and maybe definitely take that step above just IgG testing. When do we jump up and look at really what we can get with the additional inflammatory related information on our fit? Like every patient that we're trying to lower and reduce inflammation on. But I find this to be a fabulous tool for body composition, right? And in my years in practice supporting weight loss programs, I have run thousands of body composition bioimpedance analysis tests. And I can tell you sequentially what I see over and over and over again in that data is when somebody first gets off their inflammatory provoking foods, the first thing I see on my data is the scale goes down, but I also see that the total body water goes down, and the water that drops is the water caught in between the cells in the interstitial space. We call that extracellular water. So what I first see when somebody makes the right type of anti-inflammatory diet choices for them, the first thing I see is they drop water weight, that extra fluid retention that went along with that inflammatory state. That can take anywhere from 4 weeks to 12 weeks. So I watch those numbers drop on the scale. I watch those numbers behind the scene on the BIA. Then we hit a certain level where the fluid dump is done. And that's where I really start to see the metabolically burned fat. And then from that point forward, you can watch the total body water level stable, the cell fluid distributions are stable, and we can see the body fat burn begin with the gain of muscle. And for me, I am using nutrition as the base for all of these patients. I want to know if I'm putting them on the right formulas, because some of these formulas I might want to use for 3, 6, 9, 12 months. So I want to know if my patient has a sensitivity to turmeric. I want to know if they're sensitive to monk fruit or stevia or vanilla. There's these ingredients, right, that are tested on this Fit 176, and I have a love-hate relationship with the results. I have to tell you, because I'm so happy to know, but there's times where these profiles will come back, right? And I'll be looking at their sensitivities, and people will be allergic, sensitive, and reactive to a dozen foods or ingredients that we would think are anti-inflammatory, right? And then we go back to their formulas and their ingredients, and we recognize, they're eating and taking in way too much of that ingredient, and they've now created this inflammatory response to it. Right. So weight loss programs, autoimmune challenges, like I said before, pain, brain, and drain. Right. That's kind of a governing rule for me. If there's pain, if they're having brain fog, brain inflammation, or they're drained, their immune system is incapable of reacting appropriately, those are going to be kind of the first pass patients. Just to really call it out. Hashimoto's, autoimmune thyroiditis, this is one of the first tests I'm going to do. I want to know exactly which foods to pull out of that system. I am incredibly impressed at what we can do with dropping antibody levels, bringing down those anti-thyroid peroxidase antibody levels. I mean, these are trackable resources. And in the world of autoimmunity, it is incredible to watch reductions in our inflammatory markers and our peripheral inflammatory markers that relate back to issues with joint, cardiovascular system, skin, gut, etc. So if a patient comes in the door and any of these are on that first page of why are they here, absolutely, this is absolutely going to be one of my very first passes. So do you want to talk a little bit about the technology and speak, if you don't mind, for a few moments, James,
Sure.
to just the value of adding in the additional, complement testing?
Yeah, exactly. And so this is back to that point about the whole immune system, really, in terms of where you've got some great companies out there looking at just the IgG. And as I say, the limitation isn't those companies, it's that pathway, because it's really telling you with the IgG element which foods you're exposed to. Now, we've all got to be exposed to food, so that's a reality of it. The question is, where we really differentiate is when you start looking at the back end of this slide, because again, you're moving into the innate immune system and going, okay, how can we measure those immune complexes? And how a lot of the providers explain it to their patients is the exposure is not a bad thing. We need to work out what you're exposed to, but what this test does, it gives you a way of looking at what's going on from an inflammatory standpoint when you're seeing that complement activation in the innate immune system. So that's the big difference here, is how do you move from just exposure to that secondary screen, which takes out a lot of what we would describe kind of in a lab world as kind of false positives. A good description of that is, I ran an Everly well on myself and I had 20 foods elevated. When I ran the FIT test, I had 5 foods elevated. So again, that difference of 15 is what we call a false positive. So in essence, that's what it's helping with. It's trying to get to which foods are really causing that inflammation. Given Christy's done a great job of showing, what's the problem with inflammation. These are the symptoms that they're causing. And so again, if you can get to the root cause by identifying which foods cause inflammation versus what they're exposed to, then that's what's taking you to a higher level of understanding, as well as treatment protocols for patients. Because as we all know, if you give them 5 to eliminate, there's a high likelihood that they can buy in from a compliance standpoint. 20, they may be nodding, but the compliance is going to be a real struggle and an issue. And historically, we've always said, well, if there's more than 10, they've probably got leaky gut. So again, the nice thing here is we've now moved on the model from, rather than saying, guessing that, we're making sure we've got a great test to kind of run alongside that. So that's a kind of quick description of how we read that immune complex formation on that slide, Christy.
That's great. And so just reiterating, right, and looking at that acquired immunity, this is one of the pieces that we're getting certainly from this test. We're getting it from others as well. And we're looking at those 4 subclasses of our IgG 1 through 4, right? We do know that's that IgG 4 that we're most commonly looking at and tracking back to look at these kind of slow brewing provokers. But know that it is Ig 1, 3, and looking at IgM can all activate complement, right? And so it is nice to be able to look at how is the innate immune system responding, in which ways is it reactive, because I think this is really a defining point. Why I'm testing for foods in the first place is because my patient has gut challenges or inflammatory challenges. I'm managing the gut or systemic inflammation or both, right? And it's one of the things I really appreciate that this test will give me that extra base of knowledge around. So again, just reminding us, this is patented. Again, the capability of being able to test for, screen for, and identify these inflammatory related foods. We greatly appreciate this enhanced sensitivity. And I can tell you, I've seen the difference. I've been running these tests in my practice for years. And gosh, I was thinking the other day, James, that I don't know if it's possible, but I wondered how many KBMO tests have I read? We
will we'll get you that number for the next one. But
right, with my
this is a great slide to share with patients. You can show this one to a patient, because when they come in and say, but I can get a test off the internet, you can go, absolutely you can, and I'll show you which side of this diagram that test is from. And so again, I think sometimes you get that, and some providers feel a bit it's a tough sell sometimes, but it shouldn't be a sell. It should be, look, let me explain, and as Christy's talking about, educate with showing this kind of information to them so they can say, look, you've got exposure, or you've got exposure and inflammation. And so that's the key difference here in terms of, as we try and explain it. So frankly, for me, providers, but you guys, I know it's more patients.
Yeah. So why? I think we've been answering that question over and over again, but really to drill it in, I remember the very first conversation back in Beijing, talking to some of my other peers who were getting to pilot and really work with some of this data. And what did they say coming out of the gate? They're like, this test does the best job that we're seeing right now in picking up those foods connected back to chronic inflammation. And quite frankly, if you are a functional medicine practice, it's inundated with patients who are walking in the door with chronic inflammation and chronic disorders. So I can say I've been around long enough now with KBMO to watch the inclusion of new tests, to watch these tests grow, to watch these tests expand and see new profiles. It's something I've loved about your company. It's innovative, James, and you guys are always adding advanced resources and tools to what we have. This year, we got this expansion of the 176 list, right? We've got this beautiful addition of additional foods to screen for, but we also got the gut barrier panel. And we'll talk about it in one of these upcoming months, the new FAST test, which I am intrigued by and just barely starting to play with now in my practice. So do you want to talk about the food list?
Yeah, so this gives you, we've gone slightly old school these days, and we laminate this. So again, that was a pre-COVID thing, but the idea was to say, look, here's a list that we can provide for patients and providers. How is anyone expected to kind of remember 176 anything? So the idea here is it's color coded. The yellow foods they're called the Fit 22. So that's 22 of the most common foods. The yellow plus all the green ones here are our Fit 132, and that's 132 foods, colorings, and additives. And we've got everything on here is the Fit 176. And frankly, as we've launched that, we've found more and more providers moving to that Fit 176. Yeah. As we were talking about earlier, it gives a much better kind of way of looking at some of the supplements that Christy was talking about in terms of the addition there as well. Christy.
Yeah. And I really love the new expansion, the addition of the additive portion of the panel. I think that's really helpful. Like I said, for me, not only am I going to guide diet nutrition, but I love the opportunity that you offer with not only those additives, but also so many of the ingredients that we're finding are becoming anchors or staples in quality nutrition, in quality nutraceuticals, and quality formulation. So, I've continued to watch, your resources become a helpful guide in us being able to navigate not only the food and the diet, but the opportunity to keep kind of moving forward and making better choices with nutraceuticals.
And those colorings and additives, as you say, we look at it kind of like a 3D world in some regards. So the first one is processed foods, where you're seeing more and more of these colorings and additives. I always give the example of, the red dyes invented by Bayer Pharmaceuticals after World War II. They had no idea that would then end up in the food chain. So again, that's an interesting one. And then you've got supplements, as you rightly said. They're increasingly found in supplements. And thirdly, personal hygiene products. And so we're hearing more and more from providers where they're saying, patients were elevated for benzoic acid, and it turned out it was in mum's washing powder, or it was in shampoos or conditioners and things like that. And so although I fully appreciate the elimination diet is the gold standard, I'm yet to find one that says, let's eliminate benzoic acid from your diet. So the idea is, by adding these colorings and additives, it gives you another kind of almost dimension to look at these foods in terms of, rather than just, what are you consuming? It's what's, hitting your skin, what are you taking from a supplement standpoint, and then that processed food as well.
I love that you're bringing that up. I don't think you and I have ever talked about this case, but one of the cases I was working with was a woman who was working in a salon, and we had figured out her celiac gene. We had figured out her gluten enteropathy. We used this to dial down her dietary conversation even further. But what was interesting is her exposure to gluten was not coming from her foods. It was coming from some of the hair products that she was using for perms and dyes, and some of the work that was happening. There was gluten was in the list of ingredients, right? And it was so interesting once she made that change at work and she was no longer breathing in and touching and absorbing that contact. It was a big transition point for her. It is interesting to see how that absorption and that ability, the skin is such an active and not only excretion point, right, but absorption point for these potential triggers.
It's funny, I was talking to another provider the other day, and she was saying the same thing, and she had chronic dermatitis, and we worked it out. It was dairy related. There's only 4 products she had, but she sent me the kind of before and after pictures. I think we'll send that out in the next week or so, but it was phenomenal in terms of that change. And as you say, it wasn't what she was consuming, it was what she was using from a work perspective. So again, on her hands, it's amazing how you've got to think of it slightly kind of out of the box in terms of how they're being exposed to some of these things.
Yeah. Yep. And why it's there. One of the things that I would say, I see a lot of really sick patients, right? And so they're coming in with very complex cases. When I get a report back like this, where do I start personally? Well, in my perfect world, the perfect world is I want them to figure out if they could give me a 21-day window where they get off any food trigger that's not a dark green. That's not how we're going to live. That is not going to be our long-term plan, right? But for my sickest of my sickest patients, my request, my ask is it possible for us to do a 21-day elimination of all the light greens, the yellow, orange, and red? And let's just see how we do at the end of that window. And then I slowly start to bring in the light greens, and then we start to bring in the yellows. So that's kind of one approach that I take. If I can negotiate the compliance with the patient, that's my plan A. If I can have at it that way while I'm managing the microbiome and I'm working with the gut and I'm working on digestion and working on probiotic state, that's going to be, like one of my plan A's. Not all my patients are ready to do that. So like you said, if they're like, look, I'm willing to make some changes, but not everything, well, then I'm going to read top down instead of bottom up, right? And so then I'm going to say, okay, can we negotiate and say none of the reds and the orange will be in your mouth for 10 days, And so honestly, it's like this conversation. I want the patient completely engaged in the discussion because I need them on board and mindful, like a food detective, to make sure that they're really compliant and that they are as engaged and excited as I am, about the connection between their food and their sense of health. So, anywhere between that, gosh, sometimes it takes my patients 2 to 3 months to be ready for a perfect 21 days. But you know what? For those 3 months beforehand, they were 70 to 80% better than before. You know what? They are going to see improvements. They are going to come back and report improvements. It is not an all or nothing kind of situation. And quite frankly, I want them sort of driving their willingness to be compliant, but yet at the same time, I'm going to gently keep sort of corralling and pushing them towards ideal, right? And we're going to find that happy middle point. It doesn't work for me to tell them what I want if I'm not cognitively capably listening to what they're willing to do, right? We can have that big cognitive disconnect and the prescription may not map to the action plan, right, that the patient's going through. So I guess what I'm saying, James, is there is a science and there is an art to working with the diet, right?
Exactly. I often call it, this is your time to be the place psychologist. When you see that bottom lip wobbling on the other side of the table, you probably went too far. So the idea is, again, you've got to work out what's right for each individual patient. I mean, it's individualized results. And again, each patient is different. Some may say, right, I'll take it all on. Others are, they're pretty hesitant even about just taking out the red. So as you rightly point out, it's horses for courses, as we say here.
It's absolutely, and I think one of the things for me is, what tools are they going to use? How are we going to support them, right? So we'll go more into this as the months go by in our series, but we've got really great support resources connected back to this test. There's an app for the patients to be able to download and get more food clues, food ideas, and get their own test results right there in their hand. So I really love the innovations that are continuing to come forward. We've got great patient suggestions for dietary modulation, so they can look at those lists and start to think about, well, what might I eat, with this type of a dietary plan presenting itself. So I appreciate some of these aspects. And then this again is just kind of signing on to the additional sort of upgrade that came with that new food list. And I really appreciate this list because these are a lot of the subtleties that I'm trying to get into the weeds about with my patients. I want to know gliadin levels. I want to know alternative grains. I want to know about coconut. For many of my pain and anxiety and PTSD patients, I want to know about CBD, right? So these are important things that I'm going to be bringing in because often I'm counseling and coaching them to try to eat many of these foods, right? And I don't want to be coaching them into an expanded diet with foods that they may then find are triggers. So I greatly appreciate the larger panel.
Yeah, no, exactly. And I think that was exactly what we did. We were fortunate to work with just over 300 providers on that to get their input to say, look, what is it you providers need? And then overlay that the issue of what are we thinking in terms of, you know, some of the supplements we're putting them on. You know, what are the newer foods that patients are now consuming? So, you know, a good example of that is you know, Brussels sprouts 10 years ago, you know, you probably wouldn't have thought about it, but today, tough to walk into a restaurant in the US that's not serving Brussels sprouts. It's amazing how some of these foods, and also healthier foods, papaya, things like that, which people are assuming are healthy for them. So for that population who are looking to improve that last 10-15% of their health, we want to check to see what are they eating there. And as well, the other one was the omega-3s as well, with the sardines and the anchovies. And
that's what I was.
Yeah, I've had a couple of providers who said to me, it's really interesting, James, I like this test, but I'm pretty confident I don't eat sardines. And I'll say, well, that's interesting. I've got a sneaky suspicion you may have an omega-3 every morning. They're like, how did you know that? I said, well, there we go. So that's what you find, the kind of hidden stuff behind when you think about, is it processed food? Is it supplements? Is it kind of some of these other things that they're being exposed to as well?
I totally agree. That is absolutely one of the things I look at. It's my protein powders, it's my functional foods, right? It's kind of looking at some of those anti-inflammatory mixes where I have multiple ingredients coming together, which I absolutely find this test to be such a guide, you know, such a wonderful guide for me to be able to make choices right on the first way through, or to be able to look at old supplements they were taking before they came in and compare that to their list, to be able to see if they had developed sensitivities to something they were taking. How can I help work on focusing on that gut barrier, right? Because then my focus is going to be all about the gut barrier. And we all do. We have awesome tools in our toolbox, you know, to be able to help mitigate food reactions, food hypersensitivities, food allergies. We got amazing tools from many different of our professional nutraceutical companies. They're going to go right after that gut barrier, transforming immune modulation, supporting digestion, digestibility, and helping us really get those improvements in the zonulin and the oculin levels when these test results come back around again and we're rechecking months into the future. So I love this slide because it's totally true. What comes first, right? Is it the food trigger, or is it the breakdown of the gut barrier? Is it the gut barrier that causes it's all, right? And then throw into the mix of it mold, right? Or throw into the mix of it, you know, another layer of candida, right? And so when you kind of put those are just fuel in the fire, right? To continue to drive that acceleration process forward. So let's talk about the new additional panel.
Yeah. So again, we've added the candida, zonulin, and occludin. So again, candida we had, zonulin and occludin are looking really at those tight junctions in terms of zonulin, how they function. Are they opening and closing properly? And the occludin, more of the structure. Is that band together, or have they broken apart? And so the other element here that we found really helpful to kind of show patients and providers is that we now measure the IgA 1 and 2 on here, because again, IgA is a secretory marker. So again, it makes sense from a gut barrier panel. IgA for a banana may not be that relevant to people, but an IgA for candida, zonulin, or occludin, we feel is much more relevant, because again, IgA being secretory is generally localized in the gut, and early stage is how we tell people to interpret it. And then with the IgG and the complement, it's more systemic by that point and later stage in terms of how we do it. So again, we've tried to simplify this as much as possible for positive and negative. And then the last point here, which I think is a key one, if any of the 6 markers are positive, we recommend to consult your provider with regards a good gut healing protocol. And we've got a number of those. We've partnered with a number of really good supplement companies, the likes of Biotics, Nutridyne, Nutritional Frontiers. So again, some great companies out there to get professional level protocols. I know everyone's got some ideas themselves, but sometimes it's nice to be able to look at what other leading supplement companies have suggested as well, to kind of be able to tap into some of that stuff at the same time.
It's great. And so I have loved this, and what I honestly will do is I'll get the test result back with the patient. I'll go to page 3 and I start here. I honestly start with looking at this panel as I'm speaking, to the patient and teaching them what I'm learning, because I want to leverage what this page is telling me, because it helps me understand how to qualify and quantify the time frame that we're going to spend working on the specific food details on the previous pages. So I want to know, are we dealing with a permeability problem? Because if we are, if this is the panel that I'm looking at, I with much more confidence can tell the patient, you know what, this is like a 6 to 12 month process. This has been going on for a long time. This has been going on for years of your life. This did not just happen. This has been a progressive pattern. And so it also, helps me put the patient in the right frame of this is a long-term gut healing restoration mindset. I want them transforming their diet for life. I don't want them to think they're going on a diet for 2 to 3 months and then they should go back to the way they were eating before. So I use this to really set the stage. I also find that, when I see positives all over the place, then I know that, yes, we have much more of a permeability, a higher probability of reactivity to foods that are overconsumed again and again and again. So I'm going to coach my patient to variety and diversity. When I see this, I'm going to say rotate, 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 rotate. With us approaching the food choices every day, I don't want you narrowing the scope and repeating the foods that you're eating. When I see a panel like this coming back, I want variety. I don't want that immune system eating the same foods every day. I want lots of variety in the diet, and I want gaps. I want nice big gaps between when the food kind of comes through and that family of foods hit the immune system once again. So I really appreciate this tool, having practiced without it for so long, and then now having the last year or so with it, I greatly appreciate it because I'm coming back around, then I can go back and I can follow up in 6 months and 12 months, and I can just run the gut barrier panel and I can see, okay, how far did we get? I can go back in and check essential fatty acids. I can go back and check vitamin D levels. I can go back and check my microbiome. I appreciate the simplicity and accuracy of this test, helping me go back and recheck the gut barrier and intestinal permeability so I know how long do we have to keep working on this, right? And if we've been working on it for 6 months and nothing changed, that is not expected. That tells me there's got to be something going on in their environment. Maybe it's mold, maybe it's Epstein-Barr, maybe it's chronic COVID. They don't realize they're long haulers. I'm going to start digging deeper and deeper because I have a window of expectation that I'm expecting to see gut barrier healing and nourishment plans work. And this test helps me see if we've hit the mark or if we've got to keep digging deeper. All right, let's talk a little bit about how you got this proprietary and this very unique way of testing. Do you mind kind of digging into a little bit of
Yeah, sure. So this has been an overnight project, as all R&D projects are. So it's been about 4.5 years in the making. So again, that's probably not how it was positioned to be when Brent started it, but that's okay. Again, like all good things, they evolve. So again, we pivoted a couple of times. And one of the key things we did is we worked with Dr. Alessio Fasano to say, look, what are some of the issues that people are seeing? Clinically, we're not seeing it lining up in terms of the zonulin protein test with clinical outcomes and symptoms. And so we were kind of slightly mystified by that. And he said, the issue that we're seeing is the zonulin protein is giving a different answer from the morning to evening. He said it's cross-reacting with haptoglobin and properdin. And he said, it's not clear why people are testing stool when all my research has been done in blood. He said, so there's a number of issues that need addressing if you're up for that challenge. And so rightly or wrongly, we said, yeah, I think we're up for that challenge. And so we went back to basics to the point that we now are proud owners of 4 goats in northern Maine, and used those guys in terms of to kind of develop the zonulin antibody, which we came up with on the back of the recombinant zonulin protein that we developed. And that was with a great help from Dr. Brent Dorval, again, with his kind of diagnostic and assay development skills. So what we've done is it's a unique recombinant zonulin protein to KBMO. It doesn't cross-react with haptoglobin and properdin, and it's enabled us to develop an antibody which is a lot more stable and uniquely stable versus the protein. So we went around dealing with the issues that Dr. Fasano had mentioned, and that's in the literature as well. So it was interesting to see that. And what we've now seen is with the launch of this assay, a much more similar positivity rate that Dr. Fasano had published in his Lancet letter back in early 2000. So it feels like we've got to the root cause of zonulin. But again, what we wanted to do is, if you think of leaky gut more of a continuum versus a single marker, we found that it would be much more helpful and beneficial if we could look at the IgG and IgA for that, and then also add the candida, the zonulin, the occludin, and then we'll talk about some of the other things that we're considering to adding to that as well.
Great, good. Thank you. And every time you and I talk, I learn something new every time. I really appreciate it. right? And I've seen plenty of cases coming back this way, right? I end up, especially in this era of managing many undiagnosed long haul COVID cases. I am actually seeing these patterns of mycotoxins, undetected candida infections, Epstein-Barr, CMV, and then exposure to COVID happens. And so it is really quite profound to see how often this aggregation, the multiple factors coming together, really do manifest a challenging scenario. I have to say that I did my little happy dance when I saw the LPS on here. I was hoping that you would teach me a little bit more about our timeline today. I am thrilled to be able to have access to looking at LPS and the considerations that will offer for us in looking at the presence of endotoxemia. So how soon and what can you share with us, James?
Yeah, so the good news is we're hoping to get this launched by the end of April. So again, we're already in April. So I think worst case, probably mid-May. So the idea is that it's very, very close to being ready. And again, to your point, Christy, we kind of listen to what people are saying. It's always one of those things. Whenever you launch something new, people go, well, that's great, but what about, and in this case, the what about was LPS. So again, we got the R&D team who thought they were going to get a bit of a break, and we got them fired back up and doing this. So when we talk gut health in the next one, we'll go into more depth on LPS as that gets launched, kind of, as I say, the end of this month, kind of early May.
Great. Fantastic. Well, I'm excited for that. I cannot wait. So kind of in wrapping things up, I think one of the things that's really unique to the FIT test, you can certainly see is the multi-pathway detection that's going on here. We absolutely not only see it as best in class, but we see that there are a substantial amount of very high level functional medicine practitioners who've been using this as their primary testing for food triggers in their practice now for years. And so we've got this very robust international clinical base of practitioners who have certainly not only support this tool, but continuously teach and train other practitioners and their peers to use it well. I think we're going to talk a little bit more next month about some of the clinical studies and those clinical trials that are out there, and the integration, bringing the testing together. And what an amazing science board and advisory team that continues to come together to keep advancing this test. Just in the 5 years I've been working with all of you, the advancements have been clinically substantial. So to the new practitioners who are on with us or viewing this at a different time point, there's many different treatment protocols that you can draw from some wonderful companies out there, Biotics, Nutridyne, Nutritional Frontiers, great resources. If you work with any of those companies, please reach out to them and ask for more. Do you want to talk a little bit about the videos and some of the marketing support materials?
Exactly. So we've continued to kind of build out the website, because again, to your point, Christy, not everyone can jump on these things at the time prescribed. So all these videos will be posted on our website. We've got some short ones up there, 4 minutes. We've got kind of, how to review kind of the report as well. That's only a 10-minute one. So again, the idea is to try and fit into everyone's working day, and not everyone can take an hour. So again, this one is an hour, but again, the idea was it's an introduction and a good launch to this series of 4 talks that we're going to be doing anyway. So again, we continue to build out patient trifolds, as I said, the laminated copies of the foods we test. So again, trying to make your jobs as easy as possible. We also have Dr. Val, who's available for any consults on any reports as well. So again, she's always readily available. So the idea is trying to give you as many tools to make sure that as you start running these tests, that we're supporting you all the way through. And as you get going, generally you start kind of gaining in confidence, but we're there to kind of make sure that as that kicks off, then we can support you as much as possible. We got Christy there. Christy. Whoa. Not sure what happened there, guys. We've lost Christy, but what we can do is we can take some questions. So if anyone's got any chat questions, we can put them in the chat room here. We can kind of go through those as we go through. I see Chuck Meese there. Nice to see you, Chuck. It's been a while. Lots of other good people on here as well. So cool. We've got one question here on the colorings and additives. So they have been involved. Here we go. Let's admit here. Is she back with us? Oh, yeah, I think her internet's dropped. So there was a question here about the colorings and additives. So yeah, those have been always included on the panel. So they've been there really from day one. We've added a few more on the 176, but on the Fit 132, they've been around for a very long time. And then there's another question about shellfish. Yes, they've been included on the 132, and we've beefed that up a little bit more on the Fit 176 as well. Any other questions here? I think that's that. So anyway, what I'll do is we will circulate the slide deck that Christy was working from. And again, if you've got any other questions, fire them in when you're looking for the offer. In fact, here she comes. Quickly, that was a quick back in. Here she comes. You there? Are you back?
Well, my internet kicked me out. How rude is that?
I know. So we're just going through any questions here. So one of them was about reintroduction of food. So I just want to see if you could kind of answer that one when that goes through.
You got it. Well, it's going to obviously be based on the complexity of the case, right? So for me, I want to know the zonulin oculin levels. If those are positive, it's going to be low and slow, and I'm going to be mindfully rotating, right? Because it's going to be a long-term plan with those types of patients. If I do not see any red zone on that third page, if everything's green and everything is negative, then I'm going to be a lot more optimistic about eliminate and re-challenge and see how do we feel when we bring those foods back in, because I are more clearly reactive and responsive to those specific foods. Am I glitching? Is my
a little bit, but that's fine. I think we got the general gist of it. I'll take this next one. Victoria Forte, I want to start providing KBMO testing for my patients. How should I get started? If you go to the info at KBMO Diagnostics, we can send us an email, and we'll send you out a new account form. And then we'll get our sales team to come out, reach out to you, and help you through that process. So anyone else who wants to do that, and obviously there's the discounted kit. The mystery magic code is Christy Hughes. So hopefully that's one that everyone can remember. So again, trying to keep that simple for all.
I don't think I've ever been the mystery magic code ever before. Today is my special day.
Good.
Well, I'm excited to dig in. So the test kit normally, depending on where you're purchasing it from, is in that higher $300 range, that $375, $385 range. Depending on, like, for me personally, we purchase and stock ours through the Nutridyne company, which is one of the multiple supplement companies that KBMO works with. So it's kind of nice for our patients. We like sending the kit out along with their supplements, which is great. So they're all warehoused for us in the same location. Also, I think there's a lot of value in looking at some of the other, I think there's such great lab opportunities now. We have for years have ordered direct straight from KBMO, fabulous service. Like 2 or 3 labs, we might use Rupa. You know, we might be kind of pulling in some of those resources to kind of make lab ordering easier for the patient, but we love this test. It's fast from KBMO, straight to the patient's house and right back to that lab very quickly if the patient is on top of following the directives.
Yeah, and so that's one of the big things we've added in terms of that, that drop ship as well. So to Christy's point, if you've got patients coming into the office, that's great. But I know a lot of you have kind of moved to kind of more of a telemedicine type approach. So again, we can drop ship to any of your patients, and again, those results come back to you. And again, there's a great video that goes out with those the test, which makes it very straightforward for a patient to be able to follow through. So
you know what, James, I didn't answer. Did either of us answer the question? The discount is bringing the test all the way down to $200 for the Fit 176.
That's what I was going to say. So yeah, so okay. that is the discount. So $385 down to $200. To give that out there. So again, the next one will be on gut health, and we'll kind of focus a bit more on the gut barrier panel and some case studies. And again, that's the great thing about having Christy, who's run this test for, as we said, 5 years at least. And I'll come up with the number of how many tests.
That'd be great. I want to know.
Exactly. By the time we come back online in about a month's time. So we'll share those dates out, and we'll send this recording out as well. So again, thanks everyone for joining us. And as I say, if you couldn't join us, then hopefully you've enjoyed this recording. And nice to see so many faces again. And we'll look forward to doing this again in about a month's time. So Christy, thank you so much for your time and effort. Much appreciated.
Absolutely. See you all soon. Have a beautiful month.
Great. Thanks, guys.